First of all, Ms. Golden Bethune-Hill, who is a registered professional nurse with 50 years of healthcare experience, who retired in 2010 as the Executive Vice President of the Riverside Health System and President of the Riverside Regional Medical Center. And that's Golden Hill there.
Hello, everybody.
We also have, as was mentioned before, Dr. Jelando Jackson. He serves as the chair of the Grand Social Action Committee, grafter for the Central Region Boulé, and immediate sire Archon for Epsilon Theta Boulé of the Sigma Pi Phi Fraternity. Dr. Jackson is the Velas Distinguished Professor of Higher Education and the Director and Chief Research Scientist for Wisconsin's Equity and Inclusion Laboratory, and that's at the University of Wisconsin at Madison. And where is Dr. Jackson? Welcome.
Thank you.
I'd also like to introduce Reverend Tan Moss. He actually was born and reared in Havana, Florida, earned a Bachelor of Science degree in Political Science and a Master's degree in Applied Social Science from the Florida A&M University and a Master's of Divinity from the Interdenominational Theological Center in Atlanta. He was ordained itinerant. Thank you for helping me with that. Okay, elder in the AME Church in 2004, and currently serves the Greater Grant Memorial AME Church. Michael Shaw, the director of the Office of Urban Male Health for the County of Alameda in California. His primary focus is to address inequities in healthcare services for historically underserved males. He also developed multiple health service models that target communities of color, at-risk juveniles, and justice-involved youth and adults. Welcome, Michael.
Thank you.
Dr. Artie Shelton, Colonel, retired USA, President and CEO of Shelton Professional Services. He's a 13-year prostate cancer survivor and a very, very strong advocate for PHEN. Dr. Shelton was appointed by Governor O'Malley to serve a 3-year term as a member of the Maryland Council on Cancer Control and was reappointed under Governor Larry Hogan. Dr. Shelton co-chaired writing the prostate chapter of for the Massachusetts Comprehensive Cancer Control Plan Executive Summary. We have a wonderful panel. Please help me welcome them all. So here's what I'd like to do. I'd like to actually ask each of the panelists to tell you a little bit more about the work they do by addressing this question. I'm going to start, if I may, Reverend Moss, with you. And I'd like you to talk about your experiences providing education about prostate cancer issues in Black communities. And if you would, highlight specific challenges that you've seen. And of course, I'll invite you to address that question from the faith-based perspective.
Thank you so much. Good morning, everyone. As just recently said, I pastor the Greater Grant Memorial AME Church in the city of Jacksonville, which includes Duval County. Duval County has a population of about 900,000 people, and 30% of those are African American, 44% of those are males, which is about 118,000 people are males. About 48 to 50,000 of those males are in the category where prostate cancer is a potential for us. In the city of Jacksonville, there are 1,600 churches, and about 53% of those churches are predominantly African American congregations. So considering the historical relevance and the impact and the influence of the Black church, which has played in the lives of African Americans throughout the African diaspora, it's a natural conclusion that the Black church in Duval County and other metropolitan communities and rural communities has a tremendous potential for disseminating the message concerning the prevention and the treatment of overall prostate cancer awareness. Thank you. One of the primary tenets of practically every religious belief system, and practically within the context of the African American church, is the concept of faith. Faith in sense of not simply believing, with a great deal of hope that something will happen before it does, but faith that embraces the sense of knowing that the provisions have been made for healing, and then trusting God to manifest it before it actually happens. Scientific studies conducted by numerous researchers have found a strong relationship between people's reliance on faith and various belief systems in positively increasing the ability of patients to effectively cope with their conditions. So faith is very important in the African American church, in the faith-based initiative, in helping not only disseminate that information, but also helping people through the process of dealing with diagnosis and treatment of prostate cancer. The Greater Grant Church has participated for the last 3 years in hosting the annual Prostate Cancer Symposium, and we've had tremendous support from our community, tremendous support from our leaders, both our elected leaders and our governmental leaders in the city of Jacksonville. We initially became involved with Prostate Cancer Symposium through the relationship between our bishop and Mr. Farrington. And our bishop has been one of our speakers for the symposium, and he's also given us authorization to bring this initiative to our 6 annual conferences, which includes Florida as well as the Bahamas. We have had a number of men, I think about 11 men in our congregations who have participated on the panels along with their caregivers in talking about their experiences, and considering all of the medical professionals that have talked about prostate cancer and given us all of the information concerning treatment, diagnosis, prevention, all of the alternatives. It has really been the impact of those who have been survivors of prostate cancer that have really tremendously impacted all of our symposiums. One of the things that we attempted to do this year, and we were very intentional about it, one of the speakers that we had that talked about faith and healing was one of the pastors from our white congregations, because we believe that not only is this a cultural issue in the black community, but it's also a community issue. And when I say community issue, I mean the broader community, everyone in the city of Jacksonville. So we had one of our pastors that was a part of our I Care organization, which is a justice ministry, to come and to speak to create awareness in some of the other congregations of diverse culture. One of the challenges that we've had is kind of been defining our success by virtue of those who attend our symposiums. And what we've come to understand is that we've got to think about defining our success based on the number of people that we actually impact and touch with this information. Mm-hmm. So one of the things that we've attempted to do is to work with all of our other churches outside of the African Methodist Episcopal Church in terms of working with their various health ministries, their health fairs, to get that information to them on an ongoing basis, so that even if they're not at the symposium, we at least get that information into the hands of men in our community, and then track the number of men that we put that information into their hands, and follow up with periodic information throughout the year as we attempt to disseminate this information holistically throughout the community of Jacksonville. And so, as I said earlier, faith has a tremendous impact in helping people recognize the possibilities of not only preventing but being healed through prostate cancer. And so we are just extremely honored and proud to be a part of the PHEN network and to host these symposiums.
Outstanding. Reverend Moss, thank you so much. As you'll notice, I'm going to give each one of the panelists 5 minutes to talk about the question from their particular perspective. I'm going to ask each of you to please speak into the microphone for recording purposes to make sure that the audience can hear you clearly. Dr. Shelton, if I could go to you next. I'll repeat the question just to make sure that, that we're clear. I'd like you to talk about your experiences providing education about prostate cancer issues in black communities, and highlight specific challenges that you've seen in your work.
Yes, as we mentioned, I'm the regional survivor, for PHEN, the coordinator. And as we just spoke about, one of my jobs is to, go out in the community. And what we've been doing is working with the churches in the community. Also, as you mentioned, Mark, I'm also the appointed by the governor as the coordinator on the Maryland Cancer Council. So trying to reach the community in the Washington, D.C. and Maryland area with the churches and the outreach into the different areas of trying to bring the message about, the importance for the African-American men to be screened for the prostate cancer. As you mentioned, I'm a 13-year prostate cancer survivor. I've seen firsthand as a physician and also as a family member the devastation from, the metastatic prostate cancer. My uncle died from metastatic prostate cancer, went from 200 to 99 pounds. Some of the obstacles that we have is just in the outreach and trying to get the men to understand the importance of getting the screening. And we've talked a lot the last 2 days in regards to the women power, and studies have shown that 65% of men that have been diagnosed with prostate cancer, they found out their diagnosis by being coerced or beat up by their wives or a significant other. One of the things I think that we need to do, we probably need to try to go and have the women be part of our mission to educate men. And by saying that, I mean we going out into the beauty salons and putting information up, that please have your men in your family, your husband, your the males in your family to take heed and understand the importance of coming out and being screened for prostate cancer. And so these are some of the obstacles, just trying to get the message out and getting the men to understand the importance. It only takes, as Clint was mentioning at Howard University, PHEN is working with Clint, Burnside at Howard University. It only takes 10 minutes for the exam, and I think we need to get the men to man up. Okay, I'm a little guy. I'm not going to hurt you. Okay.
Artie, thank you so much. Okay, next up, Mr. Michael Shaw. Again, I'll repeat the question for you, Michael. Talk about your experiences providing education about prostate cancer issues in Black communities and highlight specific challenges that you've seen in your work.
Well, good morning, everyone. 26-year public servant. How do I discuss this in 5 minutes? I'm going to try by telling you a story. I'm going to tell you a story about an Ethiopian proverb that says, when spider webs unite, you can tie up a lion. That web has become a partnership, a collaboration between the UCSF Helen Diller Family Comprehensive Cancer Center, based in San Francisco, the faith community of all denominations. Thank you. The community of African American men survivors and the public health department. That collaboration is what has become a model. It is interesting that PHEN wants to know what has worked and what hasn't worked. Tom and the PHEN crew, I want you to know that your model is working. It is 3 years ago that I discovered PHEN by accident in trying to figure out what we do in Oakland, California. We were going into churches and we were doing education, and we decided with the university we would do screenings. The first year we screened 25 men because we used the digital, I believe, because we used the digital rectal exam. The second year we educated 300 African American men in a church and screened 125 right after the symposium. We went from the pulpit to the back of the church for the screening. And then this year, our third year, we educated around 125 men, and there were some challenges in getting numbers to the church. But the beauty of it was we screened 85 out of 125. So 300 we educated, but we didn't screen as many. So I think the model is beginning to shape into being an effective model. There's another piece to this. So we decided if we're going to do education, we're going to do screenings, there must be follow-up to those screenings. There must be comprehensive follow-up. There must be a medical home for anyone who doesn't have health care. We decided that we would partner with other divisions of the health department to ensure a medical home is provided to any man who doesn't have one. And I want you to know the spectrum of these screenings went from unemployment to a janitor to a PhD to an MD. That's the level of screenings and the way we cross the African American community. We did all of that, and the flagship of this work became an African American support group for prostate health and awareness. I've been listening to my colleagues, and many of the pieces of this puzzle that they're putting in place, we put in place in California. But it's so much that needs to be done. And I've only been given 5 minutes to talk about all of that. So I want you to know, replicating this model is critical. I think it works. I'm working with a cancer center to actually formalize, is this working? I hope we're able to do a partnership. I want you to notice I haven't named a person, because to name one person and lift them up would mean that I not lifted up everyone who was involved in this. And this would not have been done without everyone involved. When spider webs unite, you can tie up a lion. That lion was prostate cancer. The target was the African American community. And I'm hoping I get a chance to talk about more of the details of the support group, which is our flagship, the challenges with bringing in churches, and the politics of a public system engaging with community at a level in which community was driving our engagement. Thank you.
Thank you, Michael. Okay. Golden Bethune-Hill. Should I reread the question?
I think I have it. Thank
Okay,
you.
very good.
Good morning still to everyone. It is certainly great to be here. And as Dr. Hall was speaking, I recall very much so, Tom speaking several years ago when preventive services came out with 40% reduction in mortality rate since the advent of the PSA. And that just resonated so much with me, I had to touch him, and I'm gonna pat you for saying it again. I'm approaching this from 4 different ways. First of all, a caregiver. Mm-hmm. My husband told you yesterday he was diagnosed in 2002. We were not married at that time. Subsequent to that, we both lost spouses and we connected later, but we've been friends forever. And we communicated with his diagnosis, and I'd like to think I had a small part in helping him to do what he needed to do as a good friend. And certainly caregiver, as he was re-diagnosed, I was very much a part of his life at that time, and I was involved in that. But my dad had prostate cancer more than 30 years ago, and thanks to the PSA, he's still alive today and just turned 99 on Friday. So there are stories like that that can be told all over. I lost an uncle to prostate cancer, but he was 92. He had many other issues going on. He didn't die from prostate cancer, but because, again, he was checked early and had treatment, he lived to be 92 years old. I'm also an advocate. I'm a co-founder of the Hampton Roads Prostate Health Forum, an organization to promote awareness and education for prostate cancer in Hampton Roads. And I think you heard yesterday, Virginia Beach, Newport News, Hampton, Virginia, Norfolk, Portsmouth, and we have Terrence has been involved with us, and Lawrence is here. Lawrence Davis is very much involved, and they're champions also as a part of this network. I'm also an educator, obviously, by nature of being a nurse. You educate all the time. And yesterday, taking a taxi to the mall, I said to the driver what I was here for. And he said, you know, I've not had that test. I changed my doctor because the doctor was telling me all this stuff and getting me confused about it. After less than 5 minutes in the ride, he said, you know what, you've convinced me. I'm going to go back and get that test done. So we're constantly educating people. I'm also a provider. When I retired from my job where I got paid, and I'm a full-time volunteer now, I opened a free clinic in our area because I was very concerned about the uninsured. The free clinic takes care of people for primary medical care, dental care, and we provide medications. And I volunteered at that now for almost 16 years as the executive director, and my husband's also partnered with me in doing that. Charlie mentioned to you when he spoke yesterday, for those of you that are here, that we're doing something every 6 days with prostate cancer. It might be a TV show, a radio show. It might be an educational program. We work with PHEN, certainly on Paint the Region Blue, and we have now about 30 churches that are engaged in Paint the Region Blue. I remember 6,000 ribbons last year, and most of them were made in my home, with many of my sorority sisters helping me and my Link sisters. And you know, it's been said over and over again, the Divine Nine, getting people involved. These groups want to participate and want to help. And I found it to be most helpful in educating my sisters and the different organizations as they go out and they can spread the word. And we have a saying, each one reach one. We have an annual event at a church in Hampton. Hampton has the highest mortality rate in our region, one of the highest. Portsmouth is another one, and Lawrence is a champion there. Terrence, champion in Norfolk, where we have other high numbers. We do involve the faith community. I'm a deacon in the church, Charlie's an elder, and we believe in that faith model, but we say faith and works. And I also say you cannot glorify God and do his work if you're sick. So we spend a lot of time using the scripture to help people understand how important it is to take care of their health. And we have been very successful in doing that. At first, we started with a donation of our own to have a ministry for health in our church. And for Men's Day, and when we talked about prostate cancer, we brought everything out. We put boutonnieres on men. We did everything we could to have them talking about Paint the Region Blue, and on Father's Day, what was important for them to be tested. And we do the prayers, and we follow the model from here. That's where we started with that Paint the Region Blue. And we have, you know, I'd love to see Hampton Roads one day just go completely blue. They changed the lighting now in the different cities for us, but we need to do a lot more to make that happen. And we've tried to provide a champion in each community. One of the things that we do a lot of is when we have the programs, we always have an educational program for screening. We don't do screenings without doing the rectal exams. And my husband, now I'm very comfortable with it too. I wasn't at first, but very pointedly says to the men, you know, you don't wait until you're bleeding or something's falling off before you go to the doctor. He's very direct in talking about what men need to do and about sexual dysfunction. He talks very clearly with the men about what that means and what you can do about it. And I believe that that's been most successful for us in getting men to come out and to get their attention. We also make women come. We have them bring their wives, and the women will ask more questions than the men very often. And not only will they ask the questions in the open session, they'll grab us after the meeting and say, please talk to my husband again. He needs to see somebody. He needs help. Because the men are ashamed to tell you that they're having a problem. And after what you heard today with the castration, you understand now more what we have to do to help our men get in clinical trials. If they hear that, what do you think they're going to say? I don't want you to touch me. I'd rather die than to have that happen to me. So we've got a lot of work to do to change that. No, we don't do that anymore. I'm saying we have a lot of work to make sure people understand that. But that is the story that's being told from years ago. And we have to make sure we don't continue to carry those stories. We've had a 5K run now for some time and walks, and we're working with Zero this time with Urology of Virginia to do an even bigger event at the zoo in Hampton. And I'm also excited, and I guess my time is coming close, that the Tides, which is the farm team for the Orioles, Ken, decided to do something. Their general manager wants to be a spokesperson for prostate cancer. So they're collecting, I think it's a penny for their gate, and they're giving us a donation. That donation last month was like $7,400, and that was just within a month's time that we were able to get some money. But they turned their bases blue, And they also had an event there that we screened at the ballpark in one of the suites. And we had 6 doctors show up from one group to come out and do this. And it was just excellent. One of our hospital systems did the screening, and they want to make that an annual or semi-annual event. And we ought to do that all over. And we've used athletes. We've used, certainly in our area, 757, we have a lot of guys that have made pro football. They will come back and be a part of our events. That helps us to get men out. Because when you say you have a famous football or ball player there, they're going to come. Again, I've said a lot already, and I guess it's time for me to stop and let somebody else talk.
Thank you, Bill.
No, I know you don't hear anymore, but thanks for making sure you clarified it.
Now, I'm actually going to take a slightly different turn here as I invite Dr. Jackson to make some comments, because as you've heard, Boulé has a very large footprint across the country in terms of numbers of men that could possibly be reached by a partnership with them. So Dr. Jackson, if you would, I'd like you to talk about what Boulé can do to carry forward across the various chapters that are involved. What can we do through a partnership with you to advance some of the things that we're trying to do here? And where do you see the impact of Boulé's involvement as you begin a partnership with us in this initiative?
Thank you. As mentioned earlier, I'm the chair of the Grand Social Action Committee. And Grand Social Action is our outward-facing work that has a focus around our community engagement and transformative outcomes and work that we do in our communities. The Boulé committed to social action shortly after 1904 and its founding. And under the current leadership of Grand Sire Archon Coleman, who you heard from earlier, the commitment has been increased. He's increased the Grand Social Action from 4 subcommittees to 10 subcommittees. And 2 of these new subcommittees have a particular focus on health. He mentioned earlier about the healthy lifestyles effort, but we also have a focus, one around tainted drinking water. Our communities are affected in our daycare centers and schools where we have young people drinking tainted water that has lead in it that not only impacts their ability to live healthy lives, but to learn. And that's one of the efforts that the Boulé wants to give some voice to as well. The efforts that we have in place, some of which you heard already, have a focus on preventable challenges that impact blacks in general and black males in particular. We have certainly desired to, over the next couple of years during Grand Sire Archon Coleman's administration, root more deeply in our communities and be a bit more broad in our scope with the work that we have been doing and thinking a bit more strategically in that way. So we've committed to increase our efforts and to push these works out in a more broad way, to be very strategic through advocacy, but also through some technological platforms that we have available to us. You've heard about some of our partnerships earlier. One of the partnerships I don't think was mentioned is that in the recently launched Black Men's Health Survey, which was launched yesterday here at CBCF as well, we have partnered with them through one of our subcommittees because, as mentioned earlier, there's a history of mistreatment as relates to black males with trials, study, and research that we want to be very helpful in partnering there because it's a landmark study and it's a key study that will be able to provide data and good information, I hope, for those that are studying in this area. And then it was mentioned about the partnership that's in place with Thomas Jefferson University to be a partner with increasing those black males that go on to medical school And we see a great benefit in that, not only because of the linkage to our founders, but because you've heard data earlier today that we are decreasing our participation in that space, and that's an area too we desire to work with. We feel that we have a unique capacity to be able to pull together some of the key leaders in our communities because the way the Boule is structured, it's a graduate fraternity, so within our fraternity we have all the other fraternities involved, and likely the key leaders in most of our social and civic and corporate organizations. And so it allows the ability to share resources, share knowledge, and share networking in some pretty unique ways, which we're being more strategic about. And the partnership here, an emerging opportunity with PHEN, is one that we are certainly excited about and look forward to learn more ways throughout the rest of this evening and future conversations on how we can be a bit more helpful there as well.
Outstanding. Thank you so much, Dr. Jackson. So, I hope you now have a sense of the quality of this panel as it relates to our discussion here about meeting the challenges of educating and mobilizing Black communities on prostate cancer issues. What I'd like to do now is literally engage a cross-panel discussion, and then I'm going to start to bring any questions that you have into this discussion. What I'd like to do is actually go back to our presenter, Dr. Hall, and ask you if you would start the discussion by addressing this question. Given your experiences and observations, considering Dr. Jackson's comments about the potential and, of course, clearly powerful involvement of Boule, let's talk about gaps. I mean, we talked about all the different things that are already going on. Is there anything that you have not heard, or any things about what you heard that represent areas that we can delve into a little bit more deeply? So where are those gaps, and what comments could you make possibly on how to address those gaps?
I don't think you told me you were going to ask me that, but this is good. This is good. Well, just last year, we completed a 25-item questionnaire looking at barriers and facilitators to participating on clinical trials. We looked at several things: your religious beliefs, your educational level, income level, your baseline information about clinical studies. And then we also looked at the significance of having a healthcare provider, and then distrust in the medical community. What came from that survey, which was mostly patients who had either prostate cancer or colorectal cancer, was a significant distrust in the medical community. Significant distrust that became more significant if the income level was less than $35,000 and if education level was less than 12th grade level education or not a high school graduate. The same with religious beliefs being at cross purposes to research in healthcare. So it wasn't, so this is an interesting concept. Research was thought to degrade the sanctity of God, that who really has the right to determine health. It's not your healthcare system, it's not the science, it is your prayers and your beliefs and your relationship. And this has been very interesting because what it's been manifesting is that a lot of people, we find when they don't quite understand what's going on with their bodies, they may not show back up, and they have told our nurse, we're just going to pray on it. We're not going to come back. Just going to pray on it. So what I have seen in my career over the past 20 years are people who have not completed treatment in the School of Medicine, and who have not shown up for surgery after having a diagnosis of breast cancer. And we see that in delays in men getting treatment for prostate cancer after biopsy comes back positive. And I think we have to address that this distrust and also using religion not in a way to support our health care services, but as a way to fall back and say, I'm not going to participate. Now, let me just make this clear. If someone was in here with chills, fever, and a cough, they'd have no problem saying, I'm gonna go get some antibiotics if I have a pneumonia and taking it, and also praying that they get better. So we need to be active participants in our health care, even in areas where we don't understand as much. And that's when the physician needs to spend more time, and we need to have patient navigators and support services on every level. So I would say I really want to engage our health ministries in helping us to carve out messages to make sure that we don't fall in the wrong box of saying, let's just hope for a miracle, as opposed to being active participants and keeping ourselves healthy.
You want?
All right, thank you. I think in our faith tradition, this idea of faith and healing is profoundly demonstrated in the biblical story of the woman with the issue of blood who had been sick for 12 long years and had sought different types of remedies, and I'm sure she had prayed about it considerably, but it was not until she actually put her faith in action and did something and went to that place where she could get cured and get healed that she found her healing. And so this model, this PHEN model for us, not only emphasizes faith in terms of our prayer and accessing God and for God to heal, but also being empowered to go and get treatment, to get testing, to do those things that are necessary in order for us to bring that healing into fruition. And so for us, faith and action works together to bring about the healing. In terms of things that we're doing to kind of address some of the gaps that we found, one of the things that I heard yesterday was the issue of transportation and how many people don't avail themselves to medical treatment and care because of a lack of transportation. And so one of the things that we're doing in our ministry is to actually provide transportation to those people who are in nursing homes, those people who are part of our homeless population, which is very significant in Jacksonville. We're actually going out and promoting the symposium and sending transportation there to bring those members of our community to the church so that they can avail themselves to the education. And this year we are attempting to have medical professionals there on site so that we can get the testing and the screening done as a part of that symposium. And then the last thing is, I heard yesterday it said over and over that age between about 45 is when you begin to get tested. And someone, I think it may have been your husband, suggested that even
40.
10 years.
We say 40.
Yeah, 35 to 40. But I believe that seed needs to be planted even earlier than that. And so
Yes.
one of the things that we want to do is access social media, hip-hop radio stations, televisions, to start planting that seed in the minds of young men, even in their 20s, of the necessity of taking care of their prostate health. And so I believe those are a couple of gaps that we want to try and fill as we are moving forward with this process.
Yes, I think Dr. Hall hit on a really critical point, and certainly one of the frustrations I felt even running a free clinic. When you have people that are not used to having health care, and I would say access to health care is probably a major barrier. I would say major. When you're not used to having health care, you're not in a routine, just as we talked yesterday about a routine of going to get your checkups. You're not in a routine of taking medications, of going to the dentist. And we have no-show rates in our environments. And you mentioned not showing up for surgery. One of the things we had to do in our clinic, when we have doctors there, some that we pay for and many that volunteer waiting to see people, they don't show, that's not good. So transportation comes into play, reminders, going to pick them up, but developing that trust right from the beginning. So in our communities of faith, one of the things that we do very often, I'll stand there and talk about Tuskegee Experiment, Helena Lack, all of the things that people are afraid we're going to do to them when they come to our facilities, as it's been done with research. You're going to do something to me that I don't want. We have to get rid of those barriers that they think about all the time and get them to trust you. So you have to follow up with phone calls. You have to go out there and talk with them. The doctors have to meet them where they are, and the way we're asking them sometimes today to provide care, and you heard it yesterday from the gentleman from Duke, they're moving so fast that they will have another room set up for the patient because the doctor doesn't have time to talk with them. Well, we might need to have somebody else there to make sure they understand what we're doing, and we can't give up. We have to keep calling them. And I've committed to doing this. We've committed in our clinic, and I'm hearing that from many of you here. Follow up with those people that are not used to having care. Help them understand the value of what you're providing for them, and let them get to trust you just by being present with them. That makes a big difference in the world. If they don't show, call them up and let them know. We've had the police help us to go find a patient who had critical values, and the patient was so shocked that we cared enough. We've gone to shelters to give people medications. So I think, we have to work a little harder because we have to overcome the barrier of people not being used to having care. And I think we have to do all of that. So I say faith and works go together, and we have to help our people understand that, because you cannot glorify God if you're sick.
Excellent.
That's my
Now,
take.
as I invite some of the other panelists to comment before I open up any questions, I want to just say to Dr. Jackson, as you begin to think about how the Boulay may get involved with this, given the numbers that you could potentially access, hopefully these comments will inform some of the strategic thinking that you do as you begin to think about how you might want to engage. So, and I'll ask you as we wrap up if there are any comments that you'd like to make in that regard, given what you've heard. But having said that, Michael, do you want to make any comments?
So, Mark, I just want to say this. A long time ago, as a public health official, I said that one day we will see African-American men in a museum. Now, I'm not playing. In Alameda County, we are 12% of the population. That is the kind of representation of the black community in this nation. So we are often focusing on pockets where African-American community is the largest. The reality is that we're 12% of this country, that our congressmen and women and senators and public officials very seldom represent us. That's why we got this black caucus here. And this is why we got a congressman in this room who does. This is why PHEN is important to us. But I put this not out of data, but let's look at the realities of our community. Yeah, one day you're going to find black men in a museum. And notice I didn't say black women. Black men suffer from the most disproportionate health issue of all of health. Now, that said, the faith community is critical. Pastoral leadership is critical. This partnership with PHEN, Congressman Meeks, I really appreciate you. That's okay.
We'll let him know.
He's on this national telecast because this is a national issue. Without PHEN, we wouldn't be doing this testing. I'm connected with a multi-billion-dollar cancer institute. And yeah, they are willing to provide the testing, but I'm committed to making this an African-American community issue that we solve. I like how my sister kept using we. Now, all of that said is we got a lot to do, folks. We got a long journey to go. If you come to my office, you see African-American men lift up community, they lift up family. This This does not negligate the women of our community. But if we don't empower men to be the answer to men's health, then we're making a huge mistake, folks. That's my comment. I hope I get some response from it.
Excellent, excellent. I'm going to invite that response right now, because what I'd like to do is actually now engage the audience in this dialogue. So you've heard a number of the initiatives that are going on. You've heard the panelists identify some of the gaps from their perspective. What are you not hearing that you're experiencing about gaps? What are you not hearing about potential solutions? Would love to hear from you.
Before I ask my question, I want to thank the panel, because as a pastor in the African American community, I started getting information from PHEN when I started pastoring in 2008, 2009. I never came to one of these conferences. I figured everybody just have some people show up and do some talking. But the level of people that you've had speaking has been awesome. I mean, it's been awesome.
Thank you.
It's been awesome. I have it's kind of a personal question, because I'm a cancer survivor, but not from prostate cancer. And so cancer awareness is very important to me. But one of the issues I'm having, that as an African-American pastor, I don't have a lot of the resources that maybe some churches have. I'm in a low to middle income area, but my passion is to get the information out. And so since I retired from the government, my schedule is a little bit more flexible. And I want to know what kind of things can I do. I don't have a lot of active men in my congregation, but I'm in a community that has a lot of men who are in high-risk categories, and there's something, what can I do personally? Any suggestions, any encouragement? This is a personal question. Any encouragement that I can do to help my community? I met Brother Burnside yesterday. You're going to be hearing from me, right? Okay, we're going to talk. Yeah, it is your name, right?
No.
Bridgewater, you're Burnside. I'm going to connect with you, too. But I talked with Brother Bridgeside yesterday, but what can I do as an individual who has a passion for that? My father died of cancer. My uncle died of lung cancer, and so I have cancer throughout my family, so I know I am in high risk, but I also have high passion for doing something, but I'm not sure what it is I can do to help my community.
Well, of course, I have some PHEN comments to make about that, but I'll let you guys.
Let me just say, you're automatically a member of our Survivor Network right now, and we will engage you to help us do a lot of things in your community. Okay, and we appreciate that. So don't leave until we sign you up.
And PHEN,
I'll be the one you'll be talking to, so we'll talk.
PHEN provides resources for those symposiums that Tom is suggesting. It's amazing resources that a church can actually get education, get screening at no cost to you. PHEN really believes and understands how churches work.
Make sure you understand my question. I get the information. I have the passion, but I need the resources to take that from me.
Yeah, that's what he's talking about.
That's exactly what I'm talking about. And I want to add that in my local community, the pastors came to me as a public health official and said we had an obligation. And if you want some help in working with your health department, I would be very happy to help you shape that dialogue and make that kind of bridging. Because it works, and it's our money in these systems.
Please.
What Dr. Hall resonated with me, your particular issue about people not continuing with the with follow-up because of religious reasons. My uncle had prostate. Thank you. My uncle had prostate cancer, and he was a professor, and he didn't try to get help until the bitter end, and he died. My daughter was diagnosed with Hodgkin's lymphoma, and I have a cousin who kept encouraging her not to get the treatment, kept telling her that you shouldn't put poison in you. My daughter had no symptoms all through college. And then when she, I gotta stand too? Okay. Okay, I'm okay. It's okay. And my daughter wasn't sick until she had the chemotherapy and radiation, and understanding her additional risk as a result of her radiation to her chest.
Right.
So my cousin, who had breast cancer, never had any treatment, did everything holistically because of religious reasons, and she died. So, but she didn't get sick to the bitter end, whereas my daughter was sick all through chemotherapy, through radiation. My daughter's fine now. So that's a big issue. How do you explain to people who are educated, know better, they see treatment too late or just not at all after a diagnosis? So that's an issue for me, and it's been in my family. Thank you.
I think this goes back to a significant amount of legitimate distrust in the healthcare system. People would go to the hospital and they would not come out, or if they did, they were given a diagnosis because they were coming at the late stages of disease. Or if you go back even further, you have 50 years of the Tuskegee experiment and 30 years of having penicillin readily available and withheld in the Tuskegee experiment. So even though a lot of people don't understand the details of the Tuskegee experiment, they just know good things sometimes don't happen when you go to the doctor. This is why the patient navigational system is so important, because if you have a buddy, we have a community advocacy group called the Breakfast Buddies, for example, for women. So as soon as you're diagnosed, this buddy who is a survivor goes to every appointment with you to make sure that you get through your surgical appointment, your medical oncology appointment for chemotherapy, and you make it to radiation. We actually need that kind of support and encouragement to continue on, because I can't tell you how many people will go try to find shark cartilage or some kind of water or something else to do rather than go through treatment because of underlying fear. And so I have recognized that I've got to spend more time with someone who has not been engaged in the healthcare system, because everything about it is foreign. Whereas for many of us, if we go into a great comprehensive cancer center with, 10 floors, we think they should love it. There's nothing they love about that. Everything about it is foreign to them. So we have to remember that this is not a warm and fuzzy situation on any level for people, and we need to have navigators, buddies, and support groups that are lined up from beginning to end, no matter how educated you are. Yeah.
We have a couple over here. Oh, I'm sorry.
Dr. Hall, I commend you on your presentation, and I commend your colleagues on your discussion. But Dr. Jackson said something earlier about healthy lifestyle. And would somebody comment on what are some of the lifestyle things that we should be doing to hopefully prevent prostate cancer, or to defer that day if it's possible to do it? And another comment I want to make, I spent 22 years on the Hill, and in the early 90s, we would ask people who come to the office, do you go to doctors? And it was amazing, the number of African-American men would tell us, no. They took great pride in not going to the doctor because it was a badge of machoism to not go to the doctor. And then we would ask them, well, if you had a stomach ache, headache, where would you go? To the pharmacist. And the pharmacist would tell them to take this or take that. And then the pharmacist would always tell us after, they would tell them to go see the doctor, but of course the guys wouldn't go. But they would go to the pharmacist. And that was an aside, but my main question is, healthy lifestyle, what are some of the things that we should be doing?
Right.
And so forth. Would somebody comment on that?
Sure. I'll do the basics, and maybe we can talk about it, diet and exercise. So that's a big amorphous thing, diet. But a low-fat diet really, and a diet that in lean proteins has really been shown to be important in several cancers. So let's just talk about the importance of diet in reducing colon cancer. It's specific. It is a diet that minimizes red meat and increases the amount of fruits and vegetables and fiber. And that significantly reduces your risk of colon cancer. Colon cancer is the third leading cancer diagnosed in men and women, and the third leading cause of death. We've got an excellent screening tool. I won't get into it, but the point is diet helps, and it helps across. People say, should I diet or should I exercise? I'm always going to say diet first. And I will say that because having 5 to 7 fruits and vegetables a day and having very lean protein sources like fish and beans are always going to be helpful in reducing your cardiovascular risk. Exercise is next. We know that BMI, body mass index, over 25 is overweight, over 30 is obese, are associated with 50% of the mortality that we see related to cancer. So we know that cancers of the pancreas, multiple myeloma, colon cancer, esophageal cancer, kidney cancer, breast cancer in a postmenopausal setting are all related to being overweight. So what allows us to have a healthy much exercise, at least 3 to 4 hours of exercise per week, and it doesn't have to be a marathon or an Ironman. It can be walking. So a lot of people say, I started walking, but I don't lose any weight. You've got to modify your diet. So getting back to prostate cancer, it's the data has not been as clear as we would like it to be on the impact of diet and exercise and prostate cancer risk. But come on, cardiovascular disease is still the #1 cause of cancer death. We have higher rates of hypertension and diabetes. We are going to benefit from diet and exercise. Okay.
All right, we have a couple of questions on this side. This gentleman and the next question.
Right, we'll be there, and then we'll have to see if we have any time for any more, but I see.
Good morning. I am a third-year doctoral student at Morgan State University. I'm enjoying everything I'm hearing. I want to piggyback on the story that was just said and add my story to it. I believe that health literacy, which is my focus in dissertation, health literacy and health behavior among men of color in underserved communities is the preeminent, the focus that I don't hear enough about. And as a doctoral student, I had to decide what did I wanted to do and what I wanted to focus in. And so my passion is about men's health. So when I heard the gentleman say men's health, I got excited. The story, my brother is another one of those people who fall victim to what we call black men's disease. Black men's disease is not listening to your body, not paying attention to dynamics, and deciding that I'm going to do this on my own. And I don't need no one to tell me what's going on with my body. I'll just go to the store and get some Imodium AD. I'll get some Pepto-Bismol. I'll do all those things besides going to a doctor. That was my brother's case. But to this day, because he listened, we saved him from colon cancer. And so the point of the matter is, it's about health literacy, it's about health promotion. And I have a strong belief that we get caught up on alphabetic soup behind our names. That's what I call it. Alphabetic soup does not mean that you're health literate. It means that you have acquired degrees and credentials, but that does not mean that you're health literate. So we need to make sure that we begin that conversation around health literacy among men of color.
Thank you.
If I could just comment, if you recall, I did bring that up yesterday. When we're giving out all the information, people are not understanding it with the 12% rate. And one of the things we do in our clinic is to have a session with people on the questions to ask their doctor, how do you keep track of your health, and to try and promote literacy. And maybe that's another topic, Tom, as well as something on nutrition that people seem to be interested in.
And if I can just add to both the point that you made and the point that this young lady made, we've been talking at the Greater Grant Church over the last several weeks about being contagious with our faith, and that sharing our story, sharing our faith with both believers and unbelievers. And I think that is such an important factor in impressing upon people that faith, prayer, believing that God can do things miraculously is so important, but also understanding that God has created all things, the wisdom of medicine and doctors, and all of those things are important. And so the PHEN model helps those who have gone through this process to share their stories with other people. And so they share those stories on a holistic basis, but also I think it has to be done on an individual basis, like with the case of your relatives, where someone who has had that experience can actually talk about their experience, talk about their faith, and how also their faith empowered them to get to the medical help and medical professional services that they needed in order to reach that level of ultimate healing.
Excellent, thank you.
And-
Please.
I'm sorry, but there is a case, there is a point that some people reach the point they don't want anymore, and as healthcare providers, we have to accept that that's what they want and let them go the way they want to go. So as hard as it is for us, people have a right to choose, and if we've done everything we can do to make sure they have the right information to make the decisions, when they decide it's enough for me, it's enough for them, and we have to respect that.
And it's called quality of life.
Yes.
Hello, my name is Althea Dixon. I'm also known as Alfie. And I also am a champion, regional champion with Zero, and it kind of works with PHEN as well. Some of the same sponsors and everything. And we kind of go on Capitol Hill and help lobby for cancer research. And we meet with a lot of scientists and different caregivers. Well, today, not caregivers, today I am representing myself. I'm a caregiver. My husband is almost a 12-year survivor. And one of the things I found that really helped him with our faith, with, going through everything and catching everything in time, is also education, learning about it. Like the first thing we read was the ABCs of prostate cancer. I mean, I was just going into everything trying to find out about this. But one of the greatest things that helped him was mental health, the mental health thing. Families and wives and everyone, because it affects us as well as the man. He may have the physical thing, but it's kind of like alcoholism or something. The family suffers as well. So that's very important. With so many topics that you touched on with the diet and, the dark leafy green vegetables, all that, everything working together helps. And we really have to dispel a lot of the myths and get involved in these different case studies, because if we're not there, if they don't have us to see what's going on, then how are they going to know? These cancer, when you look at prostate cancer, I don't know, I'm not trying to overtalk the scientists, but they're different forms. And maybe in this case, it's something, this one may be slow moving, this one may be fast moving. So you have to really do your specific, find out about yourself specifically and what's affecting us. And all these myths we just have to dispel. And there's a lot of help for our people and everyone, but we really have to get involved and just talk to the family. Even my little bitty grandsons, am I gonna have prostate cancer? They wanna know about everything, but they know as a family we approached it healthy, with a healthy way, and we're survivors, so.
Thank you. Sue McKinney from Krilla. A comment that Dr. Etzioni made yesterday. If you screen, you must be prepared not to treat. Combining that with a concern that Dr. Hall raised, that not treating doesn't really mean not treating. And we have to combine awareness following a PSA exam with lifestyle and dietary changes. That is part of the watchful waiting I think we need to incorporate so that people do that. I've authored a document for my company. We call it OFTEN, Optimize Prostate Health Naturally, which is a summary of the clinical trial evidence and recommendations for how men can take charge now. And it's free. Exercise is free. Nutritional changes are free, and they do make an impact. And there are several things I've picked up at this conference I'm going to include in that. But that's something we can do, and it's got to be part of the overall discussion.
Just
Can I
one
mix?
moment.
Okay.
For recording purposes, we need the microphone.
My name is Lawrence Davis. I'm from Portsmouth, Virginia, where more people die. Some people say from cancer than anywhere on the East Coast, okay? I would say this has been a beautiful session we've had. Thank Mr. Fraternity for what he's doing. I'm behind him 100%. I think that you need, most people need to be educated more. I understand what you're saying about what your company has to offer, and it's nice. But personally, as a black man, it doesn't work. For me to sit and wait and watchful see, it doesn't work for me. Okay, I've got to get this thing out of me. I was fortunate, very blessed that Mr. Wesley Coleman, okay, the school he came from, Hampton University, which has the largest and most advanced proton center in the world, cured me, okay, from prostate cancer. And I want to say that if you have cancer, get as much education that you can. Get on the line, see what PHEN is doing, see what other doctors and cancer is doing, okay? And let them speak to you in a common language that you can understand, because medical terminology doesn't mean nothing to me. When you say mortality rate, that sounds fine when I'm an educated person, but if I'm a guy on the street, when you say it's a death rate, okay, that's a whole different issue. And I take it in a different manner, okay? But I want to say thank you for letting me address this, and I wish everybody would get more education about cancer, because your sister or daughter, I think it was, that had the breast cancer would have probably survived through proton, because proton doesn't go anywhere but to the cancer, okay? Thank you very much.
Thank you, sir.
I have one comment here.
You know, I asked my doctor, why is it that black men have high rates of prostate cancer? And he said, Matt, I can't tell you. I said, is it genetics? Is it the food? Is it the water? But he couldn't tell me.
We don't know.
He couldn't tell me. So I guess as black men, we just predisposed to having high rates.
Now, we are overstressed. We don't get sleep. And those two things, I believe, is driving cancer in our community. For black men, we are the most stressed men in this country. And it destroys our immune system.
Dr. Hall, would you care to comment?
It's hard to comment on that. I think it's multifactorial. I believe that it is our environment, because we do know that there are more aggressive rates related to social, economic, and income levels and education levels, and therefore the environment. But there is some genetic influences, some very good research that's been done by Dr. Powell and others across this country that clearly show that there are some driver mutations that we see in African American men who develop prostate cancer that we just don't see in prostate cancer from white men. So the question might be, why did that develop? And it could be that it was due to something that needed to occur to resist something else years ago. But the point is, I think there's a genetic influence as well as an environmental influence.
Now, I'm actually not used to Artie Shelton sitting back down there so quietly, so I'm just wondering, Artie, if you're sitting there wanting to get into this discussion.
Now, one of the things, I go back to what, our time is getting to be of the essence, but, the biggest thing that Tom says is about knowledge is the best defense against, prostate cancer. When I was diagnosed, I'm an internist, a malologist, and a immunologist, and when I was told my PSA was 3.3, I was happy, until my doctor said it was elevated from the previous year, from 2.0. So therefore, what I'm saying, had I had the knowledge of what PHEN is teaching the men in the community, that you need to know your PSA level and you need to be knowledgeable, otherwise, because I thought I was fat and happy until short and happy, until he said that, Artie, because, you're at risk, and because of this astute physician that did a biopsy, I was able to hear 13 years later. So we really need to learn a lot. Each individual need to learn a lot, and that's what PHEN is all about. And one of the last things I need to say, Mark, since you asked me, is that Thomas, he had a lot to do with, I don't know if anyone's familiar with the Senate Resolution 529, okay? And this is important, what Tom has done, where it says this is a Senate resolution unanimously recognize that the occurrence of prostate cancer in African American men has reached epidemic proportions and is urging federal agencies to address that health crisis by supporting education, awareness outreach, and research specifically focused on how prostate cancer affects African American men. And so therefore, we really need to be behind Tom, and we really need to go ahead and get these federal agencies involved in helping us in the fight against prostate cancer, which is what Tom is doing. And PHEN.
And that's,
Mark, could I add to that? We also need to support Tom through the preventive health services by insisting that they use this as a mechanism to make sure their communications are understood. I think yesterday Charlie raised that. When they communicate their new message, that it would be reviewed by PHEN, who's connected to all the organizations, so that we would make sure it fits with what we believe people will understand.
outstanding, outstanding. So again, if you would, please help me show appreciation for this wonderful panel. And again, I thank you all.